Sandra Campbell. I'm Macmillan Nurse Consultant for Cancer and Palliative Care in Forth Valley. Often we underestimate the impact of a diagnosis of cancer, but not only on the patient but on the family and all those around them. And I see it as my role to try and help people to fully understand, try and get the staff to really understand what it must be like. So for a number of years now, I have led on training in communication skills. I help deliver the education but also work on a strategic level as to look at where are the gaps and how do we need to take things forward.
The patient participation group is looking at empowering patients in improvement in treatment and post-treatment. Sandra identified early on the PPI group that people after treatment sometimes feel cast adrift, that they still have great needs for support and needs for knowing what to do should they feel there's a recurrence.
We were fortunate enough to receive funding from Macmillan to take forward a pilot project called the One-to-One project. It provides a seamless service for patients. They link with CNS teams, GPs and others who are caring for patients around that time post-treatment, and then they see patients in their own home, perform a holistic needs assessment and make appropriate referrals to social services and other agencies. The feedback that we've had so far is that the patients, they feel more supported, and it's about giving them confidence in self-management to live with their disease.
I've worked with Sandra a number of years. She's got a real skill in being able to bring together the key kind of people, that the stakeholders that we need to engage with. She is extremely warm, caring, and has got this real character to really engage with people at all levels.
I was involved heavily in the development of the Macmillan Long-Term Conditions project, helping people with the financial strains that they feel. I think there's been over £10 million in benefits over the last 7 years since the service came into place. So it's definitely a much needed service and has made a real difference to patients living with cancer.
The sort of main feeling that people have when Sandra is dealing with them is that they have someone who is fighting their corner for them. And that's so vital because cancer is such a devastating disease and it's disempowering, and it's good to be given control and power back.